Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Jason in here with us. Is this afternoon yet?
It is.
It's an early afternoon, and this is Jason's first time visit here at Advanced Chiropractic Relief. And he comes in here with a fairly unique diagnosis that has been rendered to him by his ENT, which is an eyes, ears, nose, and throat doctor. He's been diagnosed with having Meniere's disease, which is a buildup of fluid in and around the tympanic membrane in the inner ear, and he gets super dizzy, and even to the point where he's gotten very nauseous and thrown up before.
Yeah,
even,
absolutely.
right?
Yeah, like down for 2 hours of feeling terrible. So,
and you know, he has been to a bunch of different types of practitioners for this. His ENT, medical doctor, chiropractors, and what other things have you done for it?
yeah, I've been to like an ENT, and I've had all kinds of tests done, and it just basically
They're
it
just
comes
giving
and
you
goes.
the
And
diagnosis.
diagnosis, and there allegedly there's no cure. So
Right.
that's why I'm here to see you today, see if we can nip this out real
Right,
quick.
and as you know, we don't treat any medical diseases or diagnoses, but I am going to adjust his spine, including his cervical spine, and we'll just see if it works for him or not. You know, sometimes people get great results right away, but he's gonna know and I'm gonna both know within a couple of visits. It won't be a guessing game. So I'm not treating his Meniere's disease, I'm treating the subluxations that I find in his cervical, thoracic, and lumbar spine regions, and that's what we do here at Advanced Chiropractic Relief, and Jason knew that coming in, and we went over that again today. And he's also had some radiculopathy and some numbness and tingling into his hands and fingers as well. And that also indicates to me that he has cervical segmental dysfunction or vertebral subluxation complexes. And he's got some upper back tightness occasionally, some lower back pain tightness occasionally as well. Some numbness and tingling that goes down into his thigh primarily. Nothing down in the lower legs or the feet though. And he's got some bilateral shoulder pain with a torn rotator cuff on this left shoulder as well. So that's what we found out in his history. I'm going to do his examination now, and then we're going to go from there. So we always do a history and examination on patients, and then we take them from there. If we accept them as a patient, we'll adjust them. If we don't, we'll send them to whoever we think can help them the most. So I'm going to check your posture here first. I'm going to have you close your eyes and bend your head forward and backwards for me, please, sir. And then back to neutral. Now you see he's a little wobbly on that. Did you feel a little bit of that when you went forward? You kind of leaned forward? Now see, in his posture, this is interesting. His head is way forward in the Z-axis. His ears way out here. That's why his hands are riding way out in front of him like this. Hey, here, take a look in the mirror for me, Jason. See how your ears way out here?
Yep.
Your head's way forward. You see how your left shoulder's dipped down and right shoulder's higher?
See
Looking, your left hand looks longer than your right one is not. Pelvis is shifted right a little bit. You have less room here than you do over here. So you got a little bit of a curve in your thoracic and lumbar spine right there. So
I'm all out of whack.
you're gonna see some orthopedic neurological tests that I'm gonna do on Jason today, which I normally do not show, but since he's coming in here with the diagnosis that he has, I thought it would be beneficial to show you some of the diagnostic orthopedic and neurological tests that we run on patients to rule out pathology and more significant issues so we can determine whether or not adjustments are right for them or not. Okay, so we're gonna have you sit right here for me, please, sir, facing that way. So the first test that I'm doing is it's called Foramina Compression. So I'm pushing down center mass here, which both of his facet joints are holding him up with this test. So is there any pain or difficulty or stiffness anywhere in your spine at all when I push down like that?
No, sir.
So this test here now is called a maximum foramina compression. I'm bringing his head into extension, rotating it to the right, and then compressing there. Does that cause any increased neck pain on that side?
Definitely more than the one where you press straight
Okay,
down.
on this side or this side?
This side.
Okay, so now we're gonna go back and left and down. Now this is a maximum foramina compression test on the left. Was that one as tender as the one on the right?
Pretty even.
Same? On this side, you felt that one more?
Yeah. Just
Okay.
the same as the other side.
This is right lateral flexion. Does that tighten up in your muscle there at all?
Yes, sir.
Now I push down on your shoulder like that. Does that increase the tightness?
Yes, sir.
So that's a shoulder depressor test there. It's positive. So we're gonna tilt this way now. Is this one tight right through here?
Yes, sir.
As tight as the other one?
About the same.
About the
maybe
same.
not
How
quite.
about this one?
Yeah, a little less than the left
Less
side.
than the right or left one was?
Yep.
Okay, so here's the biggie. I'm gonna lift straight up on your spine from your occiput there, did that feel better, same, or worse to your spine?
Better.
Okay, that's called a cervical distraction test. I'm contacting the occiput. I lift it straight superior in the y-axis. A positive test is if that makes the patient feel better, if it's the same, or if it gets worse. Those are all positive tests that indicates he has cervical compression, and distraction influences that one way or the other. Now I'm gonna test his right deltoid here. I'm gonna push down, resist. Good, same thing here, resist, excellent. So his deltoid's 5x5 strength, so I don't need to check his biceps and triceps because he hasn't had any weakness in those. I want to check his C6 reflex here on the right, which is his biceps muscle. This is also C6, brachioradialis. C7 is the triceps. He's all 2+ equal and active on those, so his reflexes are within normal limits. So far on the right one, there, just let that relax. There we go, works better when you relax. There you go. Okay. Wow. Now, your patellar reflexes leave a little to be desired. Wow. Now see, he's not kicking much even before I do the ring gear on him. Oh, there's the problem. There we go. That's better Achilles than you do patellar. Let me just hit those from this side here. Boy. And we're going to do that over on him after we do the ring dinger on him today, because I am going to accept him as a patient. He didn't have any real adverse orthopedic neurological findings there, so you're relatively intact, except for this one.
I know. Still, it's a work in progress.
That's right. All right, let's stand right here and face the mirror for me now, Jason. So I'm going to have you close your eyes and bend your head forward and backwards for me, please, sir. One more time. And then back to neutral. Yeah, so I just wanted to make sure his posture was staying the same, and you notice his head's still forward, is still translated left, which makes his left shoulder look lower. Left hand looks longer than the right one while it's not. Okay, we're gonna lay you on your tummy here, Jason, face down in here. Now, Jason was adjusted just as recently as last week. He's getting his atlas worked on, which I think is great. Getting adjusted there with some atlas specific techniques, and he really hasn't noticed a lot of change with that from what I remember of you telling me. Is that correct?
That's correct. It's been.
I mean, it seems it's helpful, but it's not really fixing his issues. And I'm not going to tell you I'm going to fix these issues either, because we have yet to determine whether it's going to help him or not. A little right there. Lift your whole left leg up now. Does that tighten up in your back at all?
Yes, sir.
Okay, do this side now. How about this side comparatively? Looked like the left one was worse.
The left one was worse.
Okay, so he has a left sacral deviation here. He also has a left positive Durafield test on the left, which indicates left sacroiliac joints. Palpation here, he's got T5, 6 on the spinous processor. Transverses down here, T7, 8, and 9. Lumbars are very hypertonic on this right side. That's coming out of his left SI joint subluxations here, causing a reaction into his paraspinal musculature in the thoracolumbar and lumbosacrospine regions. Traps are tight on both sides. Neck's out right there on the right on the right, and right there on the right. Wow. Everything's right for you. You sleep on your side on that side all the time?
Quite a bit.
Okay, yeah, these guys, you feel those? Tight, sort?
Yep.
All right, so we are going to accept him as a chiropractic patient today because he does have cervical subluxations, thoracic spine and ribcage subluxations, lumbar subluxations, and sacroiliac subluxations. So I'm going to start off adjusting his left SI joint. Some of these might be a little sore at first, Jason, just because you've been out for a while. They'll feel better when I get them put back in place, so there we go. Okay. Let's recheck this now. Your legs are exactly even now. This already should feel a little easier than that first one did. But
Yes.
you tell me. That
Yes.
feel a little calmer down here?
Yes, sir.
Okay, there we go. There we go. Okay, let's turn you on your back. So we're always hoping for a very good outcome for the patient. Of course, we can never guarantee those things. But like Jason and I were talking during his history, it's not going to hurt him even if it doesn't cure his Meniere's disease. It's certainly not going to hurt him to get adjusted. Go ahead and put both arms out, palms up. And it may influence his neurological function out of his cervical spine and his medulla oblongata, which is his brain stem, influencing the cerebellum, which is the hindbrain that controls 80% of our bodily functions in posture, coordination, movement, and stability. Cerebellum is probably the most important neurological component in the brain for what we do in chiropractic. You should have felt that from your knee all the way up to your lower back on both sides.
And then some.
There you go. Okay, let's hit you. Face that way. Move back this way just a bit. Okay. There we go. I'm gonna have to look up and remember how to spell Meniere's. I think it's M-E-N-I-E-R-S or something.
It's M-I-N-E-A-R-S, just like ears.
Okay.
So men,
Meniere's.
ears. Yeah, I think it has something to do with the last name of a guy who
Discovered it.
discovered it. Correct.
Well, I discovered the ring dinger, and that's why I named it ring dinger. So
sure
that's
did.
mine. Let's go over here.
Everybody's got to have their claim to fame.
That's it. This is mine right here. I'm gonna lay you on your back here,
Okay.
Jason, with your pelvis there. Head up this way, please, sir. I want to pin both your pelvic bones in here. Now he's good already. He's got his wallet in his front pocket, which is excellent. Slide down just a little bit more for me, please, sir. A little bit more. There you go. Okay, I'm gonna pin your pelvis in here real tight.
Okay.
There. Bring your legs up first before I get you hammered in there. So this is Jason's very first non-surgical manual spinal decompression adjustment on the y-axis called the ring dinger. But I bet it won't be his last. There you go. And you want to take a nice deep breath through your nose. Keep your teeth together. Don't bite your tongue. I want you to wiggle your left ear. There it is, right there.
Oh my goodness.
Yes, sir. Well, that was one of the nicer responses I've heard all day.
Kept it clean. I kept
Yeah,
it
you
clean.
did. I've heard all kinds of stuff. Now, remember his reflexes just a minute ago. And not a lot better, but that left one's a lot better. Do you feel this one moving now?
Yeah, I sure do.
And this one a little bit, but not much. This one here had the most improvement on that one. Okay. Good. So I'm adjusting your atlas too, but a lot different than what you told me you were getting it done at.
Yeah.
You probably felt that all up there too, didn't you?
You adjusted it like a man.
Yeah, there you go. No snowflake in this office. There you go, Phil. Even Renee's not a snowflake.
That's wow, that was great.
Yes, sir. Well, I'm not done yet. Still gonna shoot.
Okay. Oh yeah, we gotta do some zapping.
Yep.
All right.
Make sure you don't fall over. You dizzy right this moment?
No, sir.
Well, that's a good sign,
Yeah,
actually.
because I think I mentioned to you I was a little bit on the
Yeah.
dizzy verge when I came in. So
Yeah.
I mean,
Okay, well, close your eyes for a minute. Let me just see you stand there. I got you. I won't let you fall. That's pretty stable. Put your feet all the way together for me. This is a neurological test, too. This is called, what's the name of this off the top of my head? I do it all the time. I just can't remember the name of it. So.
Medemeyer?
No.
Renee?
No. Gosh darn it.
Spread your legs apart again.
Yeah, I'm gonna stretch these out now. I'm gonna bounce your muscle spins while I think of the test. God, that's so stupid.
If there was a movie, I could be able to tell you.
Yeah, right. Here we go. It's a test for cerebral brain function. It's the patient falls over to one Romberg. It's a negative Romberg.
yes.
I knew that as sure as I'm standing here. You couldn't think of it. If you ever have that right on the tip of your tongue, can't think of the word. I hate when that happens. Yeah, there we go. Negative Romberg. Now, close your eyes and flex your head forward and backwards again. I got you, I won't let you fall. Is there any dizziness right there when you're doing that right now?
No, sir.
You look pretty stable right now.
Feel pretty good.
Take a look in the mirror, see you're squared up like a military man now. Your shoulders aren't so rounded forward now, your
I
hands
see.
are a little further back.
See what you're
Your
talking
ears
about?
coming back here, man. We want to achieve this though.
Okay.
This is optimal to get your ear over your shoulders and have your joints holding you up rather than your muscles disking your joints.
Okay.
All right.
That
So,
was
how would you
amazing.
describe your very first experience here at Advanced Chiropractic Relief with the history, the examination, and the treatment? Because
Well,
you've been to other people.
Exactly. So, what I witnessed here is we touched on everything. So,
Mhm.
I feel like it's a combination of a lot of things,
Yes,
not
sir.
just one thing. So,
Right.
we touched on a lot of the issues I'm having, and then over there, that I don't know if that's the deal right
Nothing
there.
compares to that.
That
It's the real deal.
that's a real deal.
Yeah.
for
There's
sure.
nothing
So-
gimmicky about this.
Oh no. That at first when I was in there and it was kind of tight on my hips, but then I'll
Forgot
take
all
that,
about that
I'll
when I
take that
gave
all
you the
day long. That's
decompression
right.
adjustment,
Yeah,
huh?
so very pleased with what we did today. And,
Great.
hopefully that's a start to getting
Yeah.
where I need to be.
So again, like I said, we haven't made any promises or outcome assurances on this Meniere's disease because that's just not really in our scope of practice. But I am going to adjust his subluxations of his spine, and we'll see what happens from there. So,
Yeah, we take risks and we
We-
try, and if
you know,
it works,
hey,
hey, we're both winners.
like I said, it's not going to hurt you to get it done, so
Oh,
you
no.
might as well try it.
No, definitely worth a chance.
Yeah, good. Well, thank you for sharing your
Thank
experience
you.
with everyone
Appreciate it.
today. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we treat people's spines for vertebral subluxation complexes. We'll see y'all soon.